So I'm often asked in clinic what a cheek implant can do. And effectively, a cheek implant will provide shape and projection. And what that does with the face is it supports the lower eyelid and changes the way the light bounces off the face. So, for example, we can sit here and look at my face and see that the light is bouncing off the face from here. But if I was to use a cheek implant, I could elevate that light reflex, I could push it out to the side, or I could push it more towards the nose. And that's got fantastic benefits in thinking about the shape of a face, the youthfulness of a face, and in fact also the masculinity and femininity of the way that the face is perceived. And it can also help to support in reconstructive surgery the lower eyelid position. So a cheek implant has a huge array of uses in reconstructive and aesthetic plastic surgery of the face. We use cheek implants for patients to change the aesthetics of the face, but also for reconstructive purposes, to support the lower eyelid or to rebuild the cheekbone. The implant sits on bone and it changes the shape of what we call the soft tissue envelope, which is the skin, muscle, nerves, and blood vessels, and particularly the fat pads of the cheek and lower eyelid. So what the cheek implant does is it provides shape, it provides projection, and that alters the balance of light and shadow in the face, promoting light, banishing shadow. I'm often asked how long a cheek implant might last. Generally, we would plan for a cheek implant to be permanent, to be a bone replacement. So it will fundamentally and permanently change the shape of the bony foundation of the face. The implant can be made of a number of different materials and can be fixed in a number of different ways. My preference is to use a screw fixation of the implant down onto bone. So that makes it a fairly permanent shape change. And the way to alter it would be to remove the implant at some point later, if required for cosmetic or reconstructive reasons. Our aim then is, in the absence of a problem such as infection or change or malposition of the implant, is for that implant to be fixed robustly and to provide a stable and permanent change. It's a very common question in the clinic to be asked, well, if a cheek implant will provide volume and shape, why shouldn't I just use fillers, which can be done as an outpatient procedure and for less cost? The way I prefer to look at it is that fillers and cheek implants do different jobs. A filler can be used very effectively in the cheek, but it should, I think, be used in small amounts for very particular uses. A cheek implant is a more global change throughout the aesthetic unit of the cheek, and it will provide a change in shape that affects the whole aesthetic unit from the lid cheek junction right the way down, potentially to the upper part of the inside of the lip and out here onto the cheekbone. So dependent very much on the shaping of an implant, it provides a more global change throughout the whole aesthetic unit of the cheek, whereas a filler is a more subtle opportunity to change shape and is better used in low volumes and for very particular areas, usually at the eyelid cheek junction. So they do different jobs. A filler and a cheek implant, they're not interchangeable techniques in aesthetic plastic surgery. I'm often asked in clinic whether cheek implants can be felt. This is a really key thing because of the way the implant is designed. The way that I design cheek implants is that we take a CT scan of the face, which is formatted in 3 dimensions to give a really accurate profile of the shape of the underlying cheekbone, which is different in everybody. Then we do a 3D surface scan of the face, And we can model how we want the face to look and to the change in expectation by changing the 3D surface scan on the laptop screen in clinic. And patients can describe how they want their face to look and change the 3D surface scan accordingly. So at the end of that, we've got a surface appearance of the skin that the patient would like. We've got an underlying floor, a foundation shape of the cheek from the CT scan. And the implant is made as a subtraction of those two scans. So the shape of the implant now has a bespoke floor and a bespoke surface. Once that implant is in place and fixed securely, we can run a finger from outside the implant zone to the implant zone, and it will be seamless. It will be very, very difficult to feel that implant. Now, clearly, a patient who knows their own face will, on close examination in the mirror, be able to feel the profile of the implant. But with such careful digital planning from a CT scan, from a surface scan, the implant will not be felt on a routine day by anybody else or even by the patient. By the time that implant is in, we will go through life day to day and not be aware of having implants in at all. There are many types of cheek implant. Some are off the shelf and can be slotted into a pocket and not fixed at all to the underlying bone. There is a place for that kind of implant, but it would not be my first or routine choice. A more sophisticated option, and particularly given that we want those implants to be stable and to be permanent and to be, once everything's healed, not felt. Those implants are designed in a very bespoke way. The shape of the floor of the implant is designed to match the shape of the underlying bone from a 3D CT scan. We've got then a profile of the surface of the bone, and the implant floor matches that profile exactly. The implant surface, the roof of the implant, is designed according to what the patient would like to achieve in terms of how they look. And that is done with a 3D surface scan. We project that scan on the laptop screen in the clinic, and the camera is used in the clinic. It's an outpatient clinic-based thing. And the 3D surface scan can then be manipulated by the patient doing their own pixel surgery on the screen to give them the shape they want. By the end of that exercise, we've got a surface profile that the patient is keen to achieve. We've got a floor profile from the 3D CT scan. And by subtracting one from the other, we've now got a shape, a digital shape of that implant, which is then manufactured and can be slotted into place in surgery and screwed securely down to bone. That is state of the art in terms of cheek implants or facial implants in general, and would tend to be my preferred way of doing things for a permanent, stable, pleasing shape to the face.